Tourette syndrome.
I had a snorting tic that I added a laugh onto the end of it.
One man's challenge to conquer this complicated disorder. And treating everything naturally. Advice from a best-selling doctor. It's hard enough to fit in as a child, but imagine if you have Tourette syndrome. Tourette's is a disorder that causes involuntary and very intense tics, sometimes characterized by loud barking, repetitive movements, and mood swings. Because Tourette's has traditionally been difficult to diagnose, many of those with it grow up never knowing what causes their symptoms. Allison Ansley now with the remarkable story of one man who lived his childhood without a diagnosis, but who has embraced his condition as an adult.
So you dating anybody now?
Yeah.
Dr. Duncan McKinley enjoys his freedom to be himself. For years, Duncan, who is interning as a psychologist, struggled with the mood disorders and uncontrollable tics associated with his Tourette syndrome, without recognition or understanding. Finally, Duncan recognized his own symptoms in an Ann Landers article about Tourette's.
This is the newspaper clipping that changed my life.
Unfortunately, not until he was 19. As a child, Duncan suffered enormously and never knew why.
You just sort of feel different and wrong somehow, bad definitely, and it's like growing up in a minefield. You never really know when, what's going to blow up in your face, how, but you know by the end of the day you're probably going to be in trouble.
Everyone's tics are different, but it takes a lot of energy and can be very uncomfortable to suppress those tics. Duncan tried to disguise his.
I had a snorting tic that I added a laugh onto the end of. And so again, get tossed out of class for being the disruptive or being the clown, but that was better than the alternative.
Most people have heard of Tourette syndrome, but it's still widely misunderstood. The involuntary swearing, for instance, that many people associate with the condition only affects maybe 5 to 10% of the people who have Tourette's. And up until recently, even doctors thought that Tourette syndrome itself was rare, when it's actually quite common, affecting about 2% of the population.
Psychiatrist Paul Sandor is director of the Tourette Syndrome Clinic at Toronto Western Hospital.
When I first started in this business, that is dealing with patients who have Tourette syndrome, it was thought to be a very rare disorder, 1 in a million. And I did not expect to see more than 2 or 3 cases in my lifetime. However, now I see essentially only patients with Tourette syndrome.
As for what causes Tourette's, the evidence points to a genetic predisposition.
I would say about 80% of people have other relatives who have a similar condition.
There is a wide range of severity among people who have Tourette's, and many mild cases require no intervention. Scientists are trying to find the genes responsible so that one day a diagnosis can be made with a simple blood test, because living without a diagnosis can be worse than the Tourette's itself.
The older I got and the more stuff started to come out, the more I'd be humiliated, where you know, friends would be laughing at me in the schoolyard, or I'd be getting grilled by my parents. Why are you making that noise? You sound like a freak. You want people to think you're a freak.
Duncan doesn't take medication. He found it suppressed not only his tics, but his creativity, his humor, even his enjoyment of music. The struggle has come full circle for Duncan, who makes presentations on the topic of Tourette's and is a national director for the Tourette Syndrome Foundation of Canada. And Duncan looks forward to a long practice as a psychologist, helping other families cope with Tourette syndrome and hopefully avoid the pain Duncan suffered.
Allison Ansley joins us now in the studio. Allison, what options are there for parents who have a child with Tourette's?
Parents usually receive quite a bit of information when their child is first diagnosed, and that can help make decisions surrounding treatment, or in many cases, decisions not to treat Tourette's, because often the symptoms are quite mild. Joining a support group can be an excellent idea, not just for the person who has Tourette's, but for family members as well. Unfortunately, they're not widely available yet, but they're starting to pop up more and more as awareness of the disorder increases. There might be some behavioral intervention or some counseling that is recommended. Oftentimes, there are other disorders that coexist with the Tourette's, like ADHD, attention deficit hyperactivity disorder, OCD, obsessive compulsive disorder, and that can also be part of the treatment. And then finally, there is drug therapy.
How do you decide if drug therapy is right for your child?
That can be a difficult decision that parents and doctors struggle with. Again, because of the coexisting conditions that can also be present with Tourette syndrome. If you medicate Tourette syndrome, that can interfere with the medication that you're taking for, say, ADHD. And also there can be side effects even if the only medication being taken is medication for Tourette syndrome. The most common side effect is weight gain, and certainly a lot of children are uncomfortable with that. However, sometimes medication is very effective and can be very important for helping a child to take part in a classroom environment, but there's also the trial and error factor as well. It can take a while to find the right medication for the right person.
Now, you have a couple of websites you'd like to recommend if people would like to learn more about Tourette's?
That's right, I have two. www.tourette.ca, and that's the Tourette Syndrome Foundation of Canada. And Duncan has his own website, www.lifesatwitch.com.
He's quite a character, so I'm sure that website's very informative and interesting.
I think the name says it all.
Thank you, Allison. That's Allison Ansley reporting. Well, as you just heard, 2% of the population has some form of Tourette syndrome, and half of those people will pass the gene on to at least one of their children. When we come back, we'll talk to an expert about the signs of and treatments available for Tourette syndrome. That's right after the break. Welcome back to Body and Health. As you heard earlier in the show, 2% of the Canadian population is thought to have some form of Tourette syndrome, a condition characterized by uncontrollable tics and other behaviors. Joining us now to tell us more about this disorder is Rosie Wartecker, the Executive Director of the Tourette Syndrome Foundation of Canada. Thank you so much for being here.
Hi, thank you for having us.
Why don't we first talk about the symptoms? I understand there's quite a wide range of symptoms, but are there some that are more characterized?
I think you can find anything from very mild to the very bizarre. Very much depends on the individual and, you know, the type of symptoms. Could be a simple throat clearing or
that would be mild.
little annoyance, and people would never seek medical attention for it. And then it can go right to the extreme where you have both the comorbid, as they call them, conditions or associated disorders of attention deficit with or without hyperactivity, obsessive compulsive disorder, rage, aggressive behavior, learning difficulties. There's quite a gambit.
At what age do these symptoms usually first appear?
It's been my experience in around 6 or 7 years of age.
Okay. Now, are the symptoms then would vary for everyone? I guess there's no two Tourette's cases that are exactly the same?
Absolutely. That's what makes it a very, very complex disorder in that regard.
How is this disorder diagnosed?
That's the tricky part. It's clinically diagnosed. There isn't a blood test, a scan, or something of that nature. It has to be clinically diagnosed. And, of course, there is that very small. It's like you and I going to a dentist. The toothache disappears when you arrive at the doorstep.
Right.
So it's quite often very difficult to diagnose because the children have, or adults, I guess, sometimes are inhibiting a little, or suppressing, if you will.
Right.
And so they don't often see the text. So it's probably about 5 or 10 reams of paper that are filled out by the parents, and then they try and observe.
And is this a lifelong condition?
It has been noted to be so. And then there have been the odd few that test theories and hypotheses, and of course, they're the ones that sort of, quote, outgrow it, if you will.
Right.
And but I think it might be just more, you learn to live with it, there's more of a tolerance for it.
Or like Duncan, we saw in the story, tended to mask some of the behaviors with a laugh or...
No, they become very good at that.
Right. Now, it's also not just a lifelong condition, but it can also be genetic, where people with Tourette's will pass it on to their children.
Yeah, there's a predisposition. And that is the case. And so you might file Uncle Sam. We don't have Tourette in our family, but Uncle Sam has these peculiar little, blinking or little twitch that he does, but we didn't know that that was Tourette. So if you go back in the history, you're bound to find something.
And how likely is someone with Tourette's to pass it on to their children?
That's a question we all wish we had an answer to. And if we had more of the genetic, if we had the magic gene, if we could find that, I think we could get some answers to those types of questions. But right now, it's anybody's guess. It can skip a generation, and it's a very, very complex disorder.
Now, it seems to me that we are hearing more about it now. Is that because more people are having this disorder, or is it being diagnosed more? Or
I'd like to be bold and say we've, I think, raised the consciousness level. Organizations such as ours across the country and whatnot, opportunities on shows like this to raise the consciousness in the public. And I think that more people are willing to come forward now because it's more acceptable, where in the past there was more of a stigma, let's say, than there is today.
What should a parent do if they suspect their child has Tourette's?
Probably the first line would be go to see a neurologist to rule out any other neurological or other anomalies that there may be. And from there you can maybe wind up at a psychologist, with a psychologist or a psychiatrist. Child and adolescent psychiatrist might be, your second stop.
Okay, thank you, Rosie.
You're most welcome. Thank you.
If you would like some more information on Tourette's, you can contact the Tourette Syndrome Foundation of Canada at 1-800-361-3120 or visit their website,